Welcome in, everyone. A brand new edition of Sports Medicine Weekly on this Saturday morning. I'm Steve Kashul. Later, I'll be joined by my co-host, Dr. Brian Cole, sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush, and the head team physician with the Chicago Bulls. Also one of the team physicians for the Chicago White Sox. This is the Sports Medicine Weekly, Chicago's premier sports medicine program. And net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the liveactivenow.org fund. Coming up, we're going to have our Ask the Doctor segment. We bring back Dr. Cole and have a fun segment with him. But right now, we're going to start talking a little bit about the best in physical rehab. And we're going to bring on a gentleman right now who has done a wonderful job for Ivy Rehab Physical Therapy. As we begin our show on this Saturday morning, IvyRehab.com is their website. It's Dr. Alex Bendersky. And Dr. Alex, thanks so much for joining us here on Sports Medicine Weekly. I see that Ivy Rehab was founded back in 2003, outpatient physical therapy, 90 locations just in the Midwest and Northeast itself, 13 here in Chicago area and Illinois. Can you tell us a little bit more about what you guys specialize in, what maybe sets you apart with Ivy Rehab?
Yeah, absolutely, Steve. Ivy Rehab was started in 2003, and we are primarily focused on a provision of orthopedic physical therapy. Our driving goal is to provide the highest quality of clinical care, but also to focus on establishing experienced, well-seasoned, and or advanced-trained physical therapists, occupational therapists, and speech-language pathologists here in Midwest as well as on the East Coast. Ivy Rehab is always focused on growth and, once again, providing the highest quality of clinical care.
Hey, Doc, let me ask you, what's the difference between high versus low-value physical therapy care?
That's a great question. I think one must always differentiate. High-quality physical therapy care is the care that's provided with primarily patient being in focus and patient-driven. High-quality physical therapy is provided by establishing evidence-based practice, with evidence being founded on scientific literature and evidence that guides clinical care with focus on quick and complete recovery from orthopedic injuries.
And then low-value physical therapy care, how do we distinguish that?
Well, I think low-value physical therapy care is anything that's not specific, not skilled, or oriented towards a patient. Something where usually a patient goes through just the regular motions without any specific individualized care or merit provided. So when you no longer see the need for experienced, skilled clinical care, that would most likely be a low-value physical therapy.
Yeah, I'm going through some physical therapy right now on my shoulder. It's kind of been well documented on this show, Sports Medicine Weekly. About 6-7 weeks ago, I had shoulder surgery. The tenodesis, Dr. Cole actually performed the surgery. Who else? My co-host here on Sports Medicine Weekly, and he took a part of my biceps tendon, cut it, and then reattached it to the humerus bone, and also had some clean out with my bone spurs and a little bit of arthritis in my shoulder. But I'm going through physical therapy really for the first time in my life, and I noticed that it's not easy. But you know what? You have to be, I think the patient has to be dedicated. Would you agree? I mean, it's easy just to lay down and let them kind of massage and work on you a little bit, but I got to do my part and talk a little bit about the importance of that.
Well, I think absolutely. Compliance with post-operative protocol and specifically compliance and hard work towards recovery always pays off. I think when you're undergoing care for post-operative recovery, it is always important to respect tissue homeostasis and tissue healing. The process of repair can be divided into three different categories, where the first part of repair is a granulation phase of care, where you probably were immobilized for a couple of weeks, and following that, you started doing some passive exercises and passive range of motion exercises. The second phase of recovery is proliferation, and at that point, tissues begin to harden. You start to push it a little bit more, work on active mobility and strength. And the third phase would be the maturation phase, where you're working on recovering active function, moving above, working on strength, and specifically return to play, return to golf, returning to activities of choice to make you an individual.
Absolutely. Again, we're visiting with Dr. Alex Bendersky from Ivy Rehab Physical Therapy, an advanced trained physical therapist, certified manual manipulative therapist, 16 years of clinical and academic experience. Final question. We're running out of time in this segment, Doc. Should exercises be structured and linear or diverse and variable?
So I think what we see through literature, and especially in the last couple of years, exercises have to be diverse, eclectic, and variable. I think especially when you are preparing to return to play and preparing to resume your normal function, and when your tissues are able to sustain load, proper load management, strength management, and variability in exercise will inevitably lead to better, faster, more proficient outcomes than something that's linear and predictable.
Terrific. Again, Ivy Rehab, founded in 2003, an outpatient physical therapy. Number of facilities, just 90, I should say as many as 90 here in the Midwest and Northeast. We've got 20 in Michigan, 4 in Indiana, 13 locations in the state of Illinois. Their website is ivyrehab.com. And my guest has been Dr. Alex Bendersky. Doc, thanks so much for joining us. We appreciate the new partnership we have with you guys here on Sports Medicine Weekly, and we'll talk with you again down the line.
It's been a pleasure.
Appreciate it.